Mental illness stigma continues to be a major barrier for individuals fighting mental illness. Although mental health care has improved significantly over the last decades, many people still choose not to seek treatment or quit treatment early. Stigma hurts individuals with mental illness and their communities, creating injustices and sometimes devastating consequences. I will define stigma for you today, discuss the beliefs of the Islam religion, and the factors that may influence mental health stigma in the Muslim community. Stigma is defined as situations of the individual who is disqualified from full social acceptance. Public stigma blocks individuals' access to employment, educational opportunities, healthcare, and housing. This occurs when society endorses those stereotypes against mental illness and act out on the basis of them. For example, if someone who believes that Muslim men are dangerous and untrustworthy might avoid neighborhoods in which Muslim families live, or report these men to airport police for suspicious activities, even if there is no suspicious behavior going on. The global Muslim population is estimated to be about 1.6 billion people, which makes up for about 23% of the world's population and 62% of the Muslims living in the Asian Pacific countries. Before discussing mental illness in the Muslim communities, I will describe the cultural definition of health and mental health within Islam. The fundamental tenet of Islam is that there is one God, the Arabic word for God being Allah, and Allah causes everything, including illnesses. So according to some religious leaders, illness is one method of connection with God and should not be considered alien, but rather an event, a mechanism of the body that is serving to cleanse, purify, and balance us on a physical, emotional, and mental, spiritual plane. Mental illnesses may also be perceived as a test or a punishment from Allah. In Muslims' culture, belief in qadar or destiny is strong, and while qadar may lead to death in some cases, it also suggests that positive acceptance of Allah's will and higher levels of optimism are with respect to healing. With these religious beliefs, it is understandable why some Muslims do not want to receive mental health treatment because it goes against their religion. In addition, normative cultural beliefs in the existence of jinn, which is the evil spirits, may be confused with delusions and possession of control and may prevent patients and family members from recognizing what is medical or psychiatric problems. Significant cultural differences with respect to gender may also put women at a higher risk for diagnosis of treatment of the mental health problems in the Muslim community. Because of the concerns of family standing, reports show that disclosure of mental illness is considered shameful. 75% of mostly Muslim Ethiopian families surveyed by the North Carolina Institute in 2012 reported experiencing stigma due to a relative with mental illness, and with 36.5% of them reported to be unwilling to marry into that family because of the mental health. In fact, Muslim women may avoid sharing any personal distress due to fear of negative consequences for any marital prospects or in their current marriage. A study of immigrant women who reported experiencing domestic abuse, about 70% reported shame and 62% felt embarrassment from seeking mental health services. According to the Journal of Muslim Mental Health in 2006, a study involving 459 Muslims that are living in the United States revealed the similar gender patterns. Of those 459 participants, only 15.7 reported ever needing counseling, and only 11.1 said they would ever seek mental health services. The number of Muslim immigrants in the United States and around the world is increasing, and unfortunately discrimination against this minority group continues to increase as well. Particularly in the wake of September 11th attacks, some members of the public believe that prejudice against the Muslim community is justified. Disparities in mental health within any community impact society as a whole, and in particular in this religion, it is even harder to overcome because of that stigma universally. An evidence-based approach is needed to understand what should be changed, how it should be made, and how to measure it. It is important to understand where other cultures get their beliefs from, and it is only after we reach that understanding that we can begin to learn from one another and get past this growth of stigma against a belief of a culture or more particularly the mental health capacity of any community.